We start right off with our Senator Chris Murphey. Chris, would you like to join us up here? Great, good to see you. You don't have a microphone, great. Chris, I just wanted to give a quick introduction for people who might not know you, although probably might know everybody does, but let me do it anyway, okay? Chris Murphey has really dedicated his career to serving the people of Connecticut. Not only was he elected to the Senate in 2012, I can't believe it's been that long, it's really, wow. He is the leading voice in the fight to create jobs, make sure all Americans have good health care that they can afford, and keep our kids safe from gun violence. That's been one of his very, very big issues that he's really taken a national lead on. And Chris has also gotten to be known as a person who will reach across the aisle if that's what it means in order to get something passed, which is so rare these days. The reason I said you've been serving for so long, besides going to Washington, first before you went to Washington as a senator, you were in Washington as a congressman, House of Representatives, representing the 5th District, known as the Fighting Fifth to some of us. And I remember covering you for 8 years in the General Assembly of the State Senate. So Chris, it really has been a while. You also may know Chris for the fact that he began his work to really grow manufacturing jobs in Connecticut way back when he was in the House and really strengthen our Buy American laws. That's been one of his important points of his platform every year. So, as a member of the House Energy and Commerce Committee, he helped draft the Affordable Care Act, for which we are all very grateful. So, Senator Murphy, thank you so much for being here. Would you like to take a few minutes and just talk a little bit about what's been happening?
Sure. Well, Diane, thanks so much for your commitment to this forum. I've been looking forward to this since I saw it on my calendar. I remember it very well from 6 years ago when I was running for re-election the first time in the Senate, and I was really grateful to Molly and all of the sponsors who do a lot of hard work to put this together. I think this is a really, really important endeavor. And important to me because I've been working in this space my entire political career. I've been very lucky to have been married for the last decade and a half to my wife Kathy, who works and has worked in this space for a long time, representing students primarily with disabilities, and I certainly learned so much through her work. But I really spent my career in Washington just listening to all of you and listening to self-advocates and taking your stories and the challenges you face and the successes that you've had and putting them into practice. I started out working in the area of housing for individuals with disabilities. That's the biggest obstacle that I hear most often in Connecticut to individuals being able to succeed in the community. I saw how little progress we were making on building more supportive housing with federal dollars. And so in my first term in Congress, I wrote a piece of legislation that was entitled the Frank Melville Supportive Housing Act, named after probably Connecticut's best known champion for affordable housing, and passed it. It resulted in 3 times as much supportive housing being built with federal dollars as prior to the law's passage. For those that don't know, supportive housing is independent housing in the community that has a set of support services that are often necessary for people with disabilities to be able to live independently. I'm really proud of that fact. Second, I went to work on the Affordable Care Act. We know the difference the Affordable Care Act makes to people with disabilities because it used to be the law of the land. You could lose your health care coverage because of a disability, because of a diagnosis, and that's no longer allowed under federal law. Your health care needs cannot prevent you from being offered an insurance policy in this country. And we shouldn't forget that there was a time when anybody with a medical diagnosis, and most people with disabilities, would be discriminated against in our healthcare system. So I'm really proud to have played a role there. And then more recently, I've spent much of my focus on the educational space. So I sit on the Education Committee in the United States Senate. I probably think I'm the loudest voice on behalf of students with disabilities. I led the effort to make sure that during the pandemic, The legislation we passed federally included specific dollars for IDEA to make sure that we were taking care of students with disabilities even when they weren't able to get in the classroom. And I have 3 pieces of legislation that seek to make sure that some of the worst abuses against kids with disabilities in schools don't happen. So I've got, I'm the primary sponsor of the Keeping All Students Safe Act, which restricts the use of physical restraints on kids in schools and eliminates the use of seclusion, essentially locking kids up in rooms when they are misbehaving. What we know is that restraints and seclusion are disproportionately used on students with disabilities. I've introduced a bill to ban corporal punishment in schools. If you can believe it, there's still 12 states in the nation that allows teachers to hit students when they are acting out, again, disproportionately impacting students with disabilities. And then I have a piece of legislation that says that federal funds should not be used to hire armed guards in schools. They should be used instead to hire support staff, guidance counselors, social workers, psychologists. I don't have any problem with state and local dollars being used to hire armed guards, but federal dollars should be used to hire the kind of personnel that are really lacking in our schools, especially for students with disabilities. So I'm really proud of that legacy of work, the present work that I'm doing, and I'm always really eager to share that work and to hear ideas for new legislation when I get in front of audiences like this.
Senator, since you mentioned housing as being one of the most important issues here in Connecticut, let's talk about that first. What are you doing to ensure that federally funded housing is universally designed and affordable so that all units are accessible to people with disabilities, because we know some are not?
Well, we should not take the Americans with Disabilities Act for granted. It is always under assault. There are always attempts by industry groups to roll that legislation back. I have the fortune of also serving on the Foreign Relations Committee, and I travel the world, and it's always amazing to me how little access there is in other countries that have not made the same commitment. So we should be proud of what we have done with the ADA, and we have to seek to protect it. But what's really important, I think we're going to have a big discussion. If Kamala Harris wins this election, I think one of her top priorities is going to be housing and expanding federal support and federal funding for housing. It is really important that we have individuals living with disabilities at the table for those discussions. If we're going to create new federal programming, building more affordable housing in this country, then we need to have people with the experience of seeing the obstacles that sometimes come with inappropriately built housing at the table. And all I can do is promise you that I'm going to be a strong voice to expand the federal role in housing, to get more resources so that we can build housing and make sure that this community has a seat at the table.
And Senator, there's some loud voices from Connecticut that would love to be part of that.
I know where to call.
I know, you're very well informed about having been friendly with many. I want to talk to you about something that is not just affecting people with disabilities, but is really concerning to everybody who is looking at healthcare. This has happened quite a bit in our state already, and that is private equity firms that are taking over parts of the healthcare system, including from 2013 to 16, private equity firms acquired over 350 physician practices, many of which had hundreds of doctors. In the 4 years that followed, private equity acquired another 600 additional physician practices, and that's just gone on and on since then. It's gotten bigger and bigger. And what we've learned through some of the reporting that's been done is that private equity firms offer an attractive value proposition to the physicians, right? The physicians see the possibility of less insurance hassles, having somebody else handle that in their practice, but in exchange, they give up some of the control they have over their own practices. And what we have seen, and we've seen this right here in Connecticut, we've seen private equity firms to really build their profits. They are cutting support staff, they're hiring less informed staff, less trained staff, people that they can hire obviously for less money. In many cases, they are selling off equipment. The hospital is food and a lot of stripped of all the support and equipment that's needed because of private equity. So what we're wondering about, and they're going into things like services for young people who have autism, other kinds of disabilities. What can we do to try and regulate these private equity firms from doing this? I don't know if there's any way to stop it, but it seems as though the stripping of these practices is really painful.
I'm so glad that you're raising this issue in this forum. I will provide a link to all of you. I gave a very long, in-depth speech on the Senate floor just 2 weeks ago on this exact topic. So I am just as alarmed as you are as to how we have turned over these big elements of the healthcare system to private equity firms, and how we are continuing to see the purpose of our healthcare system be transformed in front of our eyes. The purpose of our healthcare system should be to make people well, to deliver healthcare, especially to people in need, not to get the CEOs of big for-profit companies richer and richer and richer. But that is what is happening. And we've had a really awful experience here in Connecticut. 3 relatively small hospitals were bought up by this private equity company that owned this hospital group called Prospect. Those hospitals are at risk of disappearing because the companies just strip them bare as a means of making money. What we also see is that when these private equity companies come in and take over nursing homes or physician groups or hospitals, they get rid of all of the kinds of services that aren't big profit centers. And for this community, let's be honest, right? I mean, a lot of people with disabilities need a little bit of extra help when they go into the medical system. They need a little bit of additional support staff. They probably need more time with the physician. And that should be the point of our healthcare system. The point of our healthcare system should be to provide whatever is necessary to take care of everybody, but especially our most vulnerable patients. But to the private equity world, those patients with disabilities, are simply a cost drain, right? They don't make them profit. And so all of a sudden, it's not a coincidence that you see these facilities shedding the kind of support staff that supports people with disabilities when they come into the healthcare system. So what can we do about it? Well, we can certainly make a decision at the federal government level that we're going to have a preference for local ownership of physician groups, nursing homes, and hospitals, and that we're going to have a preference for nonprofit ownership. In Connecticut, we've been pretty good about that at the hospital level. Only occasionally have we allowed these for-profit companies to come in and buy our hospitals, and when that happens, it's almost universally bad for patients. So we need to have a conversation at the federal level about how we can give preference for local ownership and not-for-profit ownership. And then when these private equity companies get too much power, we just need to break them up. And the FTC is starting to do that. They brought a really groundbreaking action against the private equity buyout of physician practices in Texas, and hopefully that will provide some precedent for other actions like that in the future.
I was alarmed when they started buying up media companies, but that wasn't a case of life and death, at least, but in the medical system, it certainly is. Let's talk a little bit about pain medications. How would you adjust the current pain medication regulations to better address the pain management needs of people with disabilities, including people who have substance abuse disorder? Some people are, because we're trying to crack down on things like fentanyl use, opioid abuse, I guess would probably be the best word. It ends up that some people who have disabilities who need painkillers are being affected and are being considered just going out looking for drugs, just seeking prescriptions. How do we fix that for them?
Well, again, I think this comes down to the same problem we were identifying before. We need to make sure that patients have enough time with a physician so that the physician can make the determination, right, as to whether this is someone who is properly seeking pain medication or improperly seeking pain medication. Second, we also need to force the insurance companies to reimburse for a fuller suite of methods to address pain. Right now, insurance companies are pretty eager to reimburse for a drug, but not really eager to reimburse for physical therapy, for chiropractic, for acupuncture, all of the other ways that you might be able to address pain. So I've led an effort over the past half a decade to try to push insurance companies and to look at federal legislation that might help so that we have a broader array of pain management, not just the drug. So yes, we made a mistake in this country. We pushed out these pain medication pills far too eagerly. And I still think it's a problem. I still think there are far too many times where a doctor just flippantly and thoughtlessly gives a prescription for far too much pain medication to somebody that doesn't need it. But if we find ways to have more time in the office, if we find ways to provide access to different kinds of pain therapies, I think we'll be able to address the legitimate issues that are being brought up with individuals with disabilities.
Senator, you talked a little bit about independent living and how important it is for people with disabilities. And as you know, there are 5 centers for independent living in Connecticut and 1 statewide independent living council, which is one of the main sponsors of today's event. These centers are unique because they're run by and for people who have disabilities. So they're really an optimal place for people to live. But they have not really gained a lot of funding, and yet they have also been given more responsibilities. They have to provide more services than they did when they were first opening services, and they're services that are needed, but the funding doesn't come along with it. What do we do about that?
Yeah, I mean, I don't need to pass the buck on any of this, but a lot of this is a question of state funding. The primary sources of funding for individuals who, with disabilities, with developmental disabilities, who are going out and living in the community are state dollars. But at the federal level, we certainly have to continue to find ways to make Medicaid dollars more flexible. The fact of the matter is that when people are living in the community, yes, that costs money, but that is much more cost effective than those individuals living in less healthy settings or ultimately maybe institutional settings. So we have to have a conversation at the federal level about how we make Medicaid dollars as nimble as possible. Occasionally be used in housing, for instance, so that we don't end up using those dollars on crisis end when individuals, ultimately are in settings that are much less appropriate.
Senator, I'm just going to ask you one last question, and that really has to do with what's been going on the last couple of weeks and is about to happen again. These terrible hurricanes and storms that are really crippling communities, in some cases wiping off the map. Frequently, people with disabilities are the ones that are harmed the most. They have the least amount of money to leave, to evacuate. They are frequently trapped, left behind. What can we do if people can be evacuated? Sometimes they have to go across state lines, and that can affect their Medicaid dollars. What can we do to make sure that those people are safely sheltered and also are supported with the dollars that they need, that they had in their previous home?
Yeah, I mean, I think it's just important to know that if you're having any issue seeking transportation right out of one of these zones of impact, to immediately reach out to your local state government or FEMA. There are resources available for evacuation for individuals with disabilities. And if you know of anybody who is at risk of not being able to get out of these impacted areas, any of us in my office is willing to step in and try to fix that problem. When people are temporarily out of state, what we try to do is create sort of emergency provisions, for instance, to allow for telemedicine. So sometimes telemedicine is more difficult, but during these emergency situations, we try to provide exceptions so that people can still see their doctors, even if it's not in person. I'll tell you that, and I'm very worried right now about a lot of the misinformation that's being spread. The campaign to try to delegitimize FEMA and the federal government is going to get people killed, because it's people with disabilities that are going to have to rely on FEMA. And if they are hearing messages that FEMA, isn't doing a good job or isn't present or can't be trusted, then it's going to impact people with disabilities more. So I'm just urging everybody out there that is spreading these lies about FEMA, claiming that they're not properly resourced in Florida or North Carolina, claiming that they care more about illegal immigrants than they do our communities that are being impacted. I just hope that they'll stand down and stop playing politics and try to prioritize people getting help. Thank you.
Yes, Senator, I don't think in my lifetime I've ever heard this kind of discussion against FEMA. To me, FEMA has always been the place that you go for help when you're in your hardest moments of your life.
And they're not perfect, but boy, they're trying. They're trying their best, and they can be a life-saving resource. But they can only be a life-saving resource if people reach out and make that call. And a lot of people are being encouraged to not make that outreach.
Senator, thank you so much for that. And
thanks, Senator.
We really appreciate it. It's great to see you. You're still walking across the state? Okay, great. Good to see you. Okay, so a few important questions there, and quote that what the senator said about people that are putting up misinformation about how these things are being handled. These terrible storms, because as we know, they seem to be getting worse and worse. I was hearing today on the Weather Channel that the storm that is about to hit Florida, they may actually come with categories, raise it to another category that we haven't had before, because they think it may be that strong and that devastating, which is